Begin with the agony of patients at public health facilities as the strike called by health workers entered the second day. Now, patients remained unattended at various facilities across the country as the nurses and clinical officers maintained that they would not return to work until their demands were met. And as Dorcas Wangira now reports, some county governments have dismissed the strike as illegal and called on health workers to end the boycott.
At the Kajiado County Referral Hospital, as the nurses and clinical officers strike entered day 2, patients resigned to their fate. At the entrance, we find packed bags, a clear signal that there is no other option than to leave and seek treatment elsewhere. A woman we meet outside the ward is preparing to go. Another woman writhes in pain with her back bent, and minutes after, it dawns on her that she won't receive any treatment. She leaves as well. A mother leaves the mother and child unit with her infant. Inside the wards, patients lie helpless. A male patient struggles to breathe. There's not a single healthcare worker in sight.
Tumeambiwa tuite watu wetu wakuje watuchukua. Hakuna huduma inaendelea kutoka leo.
Alikuwa atoke kitu kama Alhamisi. Sasa leo tunatoka hivyo juu kuna madaktari. Tunapeleka nyumbani tu aende akae hivi, Mungu asaidie tu.
In Makueni, cancer patients who come to the county referral hospital were turned away. Only a few contract staff attended to patients with other health conditions. Sami Munyao, who was diagnosed with throat cancer last year, is in pain, devastated, and fears his treatment could go back to square one. At the waiting bay of the cancer unit, Joseph Bunyoli is fed by his relatives. Margaret, his daughter, hopes the nurses' strike will end soon as her father's health deteriorates. She tells us his situation is not good. Sebastian Kameja, who has colon cancer, has also been turned away and was asked to come back to the facility when the nurses return to work, whenever that will be. According to the Makueni County Health Executive Andrew Mulwa, operations at different health facilities across the county had scaled down and only medics working under contracts were on duty. In Nakuru, there is a seeming resumption of normal operations as the nationwide strike enters its second day, unlike what was witnessed on the first day, where hospital services at the level 5, Langalanga sub-county, and Bondeni hospitals were completely paralyzed, leaving patients in dire need of medical attention. The Kenya National Union of Nurses Secretary General Nakuru Chapter Cyprian Odera, however, refuted claims that normal service delivery continues in Nakuru, saying that more than 600 nurses had downed their tools. The county's Chief Officer for Public Health and Chief Officer for Medical Services have written to medical superintendents and sub-county heads demanding for the nominal roles of all staff. In Kisumu, the Chief Health Officer stated that no strike notice or official communication was given to the Kisumu County government and termed the strike as illegal. In Nairobi, a requiem mass for departed health workers who died from COVID-19 related complications was held at Uhuru Park.
The people we have lost in the medical fraternity, we could have saved all of them. They belonged to the vulnerable category.
We are not special, yes, but for the sake of Kenyans that we serve, we should be protected.
Nurses are asking for payment of 30,000 shillings risk allowance to all nurses, payment of delayed salaries, free comprehensive medical cover, declaration of COVID-19 as a work occupational health hazard, employment of 7,000 nurses in the fight against COVID-19, and the inclusion of the Health Service Commission as part of BBI.
And we are not going to relent this time until you address our issues.
The message at this requiem mass held here at the Uhuru Park by nurses and clinical officers to the government is crystal, that their lives and their safety is non-negotiable, even as their strike continues. Dorcas Wangira, Citizen TV, Nairobi.